Welcome to another episode of Insight with Tayo. I'm your host, Tayo Aina, and I'm excited to be here with you today. As I said in the last episode, that I'm going to be having a special guest today, and today has come. I have a special guest with me today. I'm going to leave her name for the last part of this. She has 6 years experience as a registered nurse. She has worked with various private and public hospitals. She has also owned a home health and home care business. Her expertise are in critical care, home health, and also in inpatient and outpatient care. She is currently doing travel nursing for the past 2 years and still counting. Help me as a welcome to Insight with Tayo, Adeshewa Aina. Welcome to Insight with Tayo.
Thank you for having me.
Thank you. So, did I miss anything out?
No, you actually hit every point. I do have a history of being a registered nurse in the inpatient outpatient hospital. I also have a history of home health as well. I love I loved home health and everything, and I did get to experience all the different endeavors of being a nurse, whether it was outpatient, inpatient, working in the critical care, working on the tele floor, all the different aspects, med surge. So I got a little bit of a taste of everything, which was very, very nice for me. So yeah, you hit everything. You hit everything.
I
Yeah.
just want to make sure that it was hit correctly.
Yes, you definitely did a great job. Yes.
So, now
Mhm.
I have some interesting topic to discuss with you.
Yeah, of course. Yeah.
And I know that with your expertise
Mhm.
and how you've been able to foster in your career,
Yeah.
you'll be able to help the viewers out there
Mhm.
learn and understand things from different perspectives.
Right. Correct.
Why did you decide to go into nursing?
Yes. So funny enough, nursing wasn't the first thing that I actually wanted to go into. I had to first figure out, apart from nursing, because I see nurses every day. I see nurses like my mom, my aunts, my uncles that are nurses. And I just felt like I wanted to do something different in the beginning. So I decided to do an internship with one of my mom's friends, that's a physical therapist, because I just wanted to see out of the aspect of nursing, what else can I do? So I did that, and I did it for a couple of months. And I didn't really feel that passion, you know. The first reason why is because I'm a very hands on person, and I'm a very compassionate, caring person as well. And I felt like I wasn't getting much of that exposure with the community as I wanted to. So I decided, I said, maybe physical therapy isn't for me, right? So I went back to my mom and I spoke to her and I'm like, hey, like, honestly, I love the internship. Internship was a great exposure and everything, but I really do think that I need to start looking into something else. And my mom, you know, being mommy, she basically brought me back and said, what about nursing? Try nursing. Nursing is a good career. You get so many opportunities. And I'm like, okay, let me start looking. So that's when I decided. I was like, you know what, let me just get into the nursing field. And I first became a CNA, you know, that's a certified nursing assistant. And then I did that for a couple years. And then I fell in love with nursing. I just love how compassionate and caring the career is, right? And that's what drew me to just fall in love with nursing. Because as an individual, whoever wants to be a nurse, right? Whoever wants to become a nurse, you have to be compassionate. You have to have the drive and the love for it. If you don't in the beginning, you can lose it at the end, and that you first start to forget what is your drive and what are other things you could do. But at the end of the day, I'm a very compassionate person, very caring, and I wanted to take care of a broader community where I see different types of things, different types of diagnosis, different types of aspects, right? Not to say physical therapy, you can't see that. You're not exposed to that. But I felt like with nursing, I got to become exposed to different types of diagnosis, different types of, from babies to elderly people. So it was a good exposure enough for me to decide, like, you know what? I think nursing
It's a career for
is
you.
a direction for me, and I know my mom too was very, very happy. She was putting in my ear, like, maybe nursing is for you. Moms know best. Your mom is the one that really knows you and your personality. So I was like, you know what, let me get into it.
So pretty much like
Yeah,
your parents had a lot of influence in your
I
decision.
would say yes. They had a lot of influence in my decision. I would say because, like I said, I am the only child. My parents put a lot of effort in my education,
Oh wow.
and they wanted me to be successful, become successful, and whatever career that I get into. The main thing my mom and my dad will always say is, um, they don't want me to ever lack in anything, and the career that I do choose, they want me to flourish in, right? And nursing, you can flourish. There's so many aspects in nursing: home health, inpatient, outpatient clinics. You can open up your own spa. You can open up your own um, anything. Honestly, you can do anything. Become a nurse practitioner. Become a medical a doctor, a PhD, right? You can hold a PhD in that career. So there's so many things you can do. You can teach, you can educate. So nursing is like just a whole bunch of things in one. So that's why I decided to become a nurse.
Your mom, she's
Mhm.
from where?
From Nigeria.
Your dad.
Nigeria.
So your both parents are Africans.
Yes, correct.
So how was the journey for you growing up
Yeah.
with parents from African heritage in America?
My brother, it was a lot.
Oh wow.
It was a lot. I was very much so very overprotect. My parents are very overprotective over me. They did not want me to do like the normal average American kid would do: go outside, have fun, go out with their friends. Very, 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 very protective. It was school and home, school, home, school, home. That's all. That is
So
it.
so
That
yeah.
was
So
it.
like, how was your like social life?
Social life was hard. I mean, like, I would say I went through a lot of phases of understanding, me being a Nigerian American, and me also, trying to understand, like, being an American and also being a Nigerian, trying to understand those different aspects and why, like, people would look at me differently, how I talk, everything like that. So it was very different for me. I had to learn how to bridge a point of understanding that I should accept who I am as a Nigerian woman, right? Because it was difficult. I had to. I would say I had to grow up a little faster and become confident in knowing that, people might say, "Oh, this is you. This is who you are," but, like, I know who I am. You know what I mean? Yeah, it was a very eye opener. Definitely, like, in elementary school, middle school, high school. Definitely in elementary school, because I mean, I was young, I was a kid, went through a whole lot of bullying, a whole lot of name calling. We all know the African booty scratcher names, all those different horrendous names, right? So, and also too, because I was the only child, I didn't have that, like, big brother or big sister to, like, fight my battles. So I had to learn how to fight my battles by myself. And, even when I come home, right, my mom would be like, "Oh, what's wrong with you? What happened?" I'm like, "Mommy, they abused me. Oh, she said, what did you do? Did you do something? What did you do something? What did you say?" I said, "I didn't say anything." So it's just like, it's because, like, the language. that my parents understand is different from the language that I understand growing up. You know, they grew up with people that understood the life that they lived in Nigeria, right? But me, I'm growing up with what I'm seeing outside and what I'm seeing indoors, and meaning that how my parents raised me in an African home is different from how the world is raising their kids. So, like, it's just like the things that my friends in middle school and high school would want to do. I couldn't do it, but I'm like, like, it's just,
But
so it's yeah,
would you
definitely
would you
different.
want to raise your child the
Hmm.
same way your parents raised you?
Yes and no. I would say that I definitely value the I definitely value the training that my parents gave me when I grew up, because that is what is basically instilled in me right now, and that is what made me who I am, right? Because, and also I would say that um, what they taught me I would use, meaning the respect, um, the love and the appreciation of your culture, and continuing that in your children is very important. um, because my dad and my mom, they never, even though yes they wanted me to understand the American way, they still did not want me to lose the Nigerian way
Of life, the
of
culture.
life, of the culture.
Sounds good.
Yes, yeah.
Sounds good. So, let's go back to your career. What's the most challenging pathway to nursing as a career?
Oh, pathway. Okay, I would say it's the schooling. It
Hmm.
really is. With nursing school, when I started nursing school, it was before the pandemic, before 2020, and it was obviously it was on campus and everything, but um, it was very. I feel like for people, and but I think also for me as well, it was very difficult sometimes, because like the exams and everything are very, very difficult. It's very, very hard to pass those exams. They put the percentage of you passing at a very, very high stake.
Oh.
Yes, they do. And this is not to make people run or anything, but like, nursing is such a well respected career that even when you're in nursing school is like military school. Sometimes they train you, they drill you, right? And it's also it's for your benefit. And another thing too is, I would say the the hardest pathway is probably even when you're done with school, when you finish,
Hmm.
because of the big exposure and the reality.
Hmm.
You will learn everything in nursing school, right? They'll give you the tools, they'll give you everything that you need to be successful. But when you go out into the world and start working in hospitals, you really start to learn how to become a nurse
Hmm.
then.
Oh wow.
Yes, that's when you start to become like, when that's when you really start to use the tools, but then really learn learn how to build yourself up, you
Hmm.
know.
Hmm.
So I would say that's a little bit, definitely the most challenging part as a new grad, trying to figure out your niche. Because with me, when I started, right, I started on the telemetry floor, and telemetry floor deals with cardiac patients. We're monitoring their heart rhythm basically every hour, every second, every minute. Nurses that work on the ICU floor, they deal with critical care patients, right? These patients come from different aspects, whether trauma, burn, neuro, anywhere, right? And they deal with severe cases. Some of them are on the ventilators. Some of them are on heavy sedations that um, that is very life threatening for them, right? Um, but when I became an ICU nurse, I fell in love with it. Don't get me wrong, but at the same time, I definitely had to learn self care
Hmm.
as a nurse, because It is so important. You're going to definitely, and nursing is such a thing about you pour so much into someone's cup, right? That your own cup becomes dry.
Right.
And you need to be able to learn how to fill your cup and know when to, because like we all hear it on the news, we all hear it on social media. Burnout, nurses are becoming burnt out and everything. And that is it's a big aspect, because a lot of these nurses, they're becoming drained out, because a lot of the healthcare hospital a lot of the hospitals in America, they're not really good with balancing the ratios with nurses, right? And it's very difficult for us because, for example, I can give you an example. For me, I've had times where I will work shifts that these people will give me 7 to 8 patients.
Oh, so like you've been overworked?
I've been overworked, yes. And that comes really back to what I was saying in the beginning about why did you become a nurse? Because it's going to be so important at the end of the day, because if you don't have that drive that is a continuous thing throughout your nursing career, it's it will make
You
you
feel
want to
so
leave.
drained. Okay, you feel so
It will
drained.
make you want to leave, because it's like the thing, if you didn't go into nursing in the beginning and feel like, oh, like this is a career that I love, that I want to be compassionate in, that I want to do for the rest of my life, right? If you didn't come into it in that aspect, if you get into the middle of nursing and you feel burnt out, there's a high percentage that you want to leave it, right? You just want to leave. So that's why it was very important for me when I was doing my search into careers, right? It was very important that I had compassion and love for the job, because it's
That's what
gonna
that's the zeal. That's what pushes you.
exactly. Yep.
Hmm. Sounds good. Now, I heard a lot of people say this about nursing,
Yeah.
but I want to ask you,
Yeah.
how fruitful is nursing as a career?
Nursing is very fruitful. Nursing is like a different is there's a wide aspect of so many things you could do, right? Home health, you can open up your own home health, home care business. You can open up your own spa business. You can I even hear nurses are in clinical research. If you just want to work from home, you can be a work from home nurse, maybe answering calls, telehealth, anything like that, for example. Or if you want to be a nurse practitioner, you can be a nurse practitioner. Or if you want to get your PhD, you can get your PhD and become a nurse educator.
That's more money.
More money. Nursing is fruitful in the education wise, in the finance department, government wise too, because you can work for the government. You could be a nurse auditor, or you can go to different places, and or different clinics, and make sure like they're doing the right thing. You can do so many things with nursing. Bachelor's of Science in nursing is such a great career to go into. I know for sure. I see it. There's so many people doing so many things, and it's just so it's so amazing to see how a bachelor's degree can open up so many doors for people. So yeah.
Sounds good though, because I know a friend of mine who's like, I remember when he was telling me that, come on, you gotta join, you gotta be a nurse. I'm like, why? He's like he was talking about how like stable the job is. Like you can
There's a lot of
easily if you decide to leave this particular role, you can definitely get another nursing career somewhere else. Like
it's a lot of stability.
the need for nursing
The need for nurses will never go, because there's always going to be people that are sick. There's always going to be people that are in need for emergency care. So nursing is very much of a need for the community to continue
It's
and
like
thrive.
it's like let's say like nursing is like the oil. that we need to roll,
Heck
that needs the
yeah.
engine to roll.
Heck yeah.
Because they have,
But that also comes into the fact, I know this, sorry, that also comes into the fact of, if there is a need, right, for nurses, there should be a good compensation for that, an amazing aspect to go into. So yeah.
yeah, sounds good.
Hmm.
So I know, like, we're running out of time, but this
Yeah.
question is really very important to me
Yeah.
personally, and to, we're both Africans,
Yeah.
and the world as a whole. There's a lot of loopholes in the
Mm.
world, right? And most definitely, different governments are
Hmm.
looking for different ways to work around things.
Mm.
But from your perspective, what do you think the third world countries, like the third world countries of the world,
Mm.
needs to improve on to better foster the growth in the healthcare system? How do you
Mm.
think the countries of the third world can improve?
Mm.
I'm sure you've seen a lot of videos. You've
Hmm.
seen, I don't know if you've been to Africa before. You've been to a third world country before.
Hmm.
So here in America,
Hmm.
like, I know things are maybe, but it's still way better than it is
Easier.
over there.
Hmm.
So what do you think can happen in those countries
Hmm.
that would help foster their healthcare system
Mm.
to to be up there?
Well, first thing I would definitely say is health is wealth.
Hmm.
If we don't take care of our people, and we don't put our people, our community as priority, we won't thrive. And when it comes to the third world countries taking healthcare seriously, I know there is definitely a huge lack. I know, I see it, I hear it, like even in my own family, when I get phone calls, and like I hear family members sick, but they can't get to the nearest hospital,
Oh wow.
or they need to bribe somebody, or they need to get money, to be able to take care of things for them. So, for example, statistics wise, a lot of things that I do, like that I read, also even like in my books and everything, African Americans, we have a high rate in heart disease, diabetes, and I feel like that should be priority. We need to take care of ourselves, and I do feel like it starts from the government, right? And the government actually taking the people seriously about what they want. And I do believe that the community wants better health care. So yeah.
So, like, the government, you
Hmm.
just mentioned the government. The
Hmm.
government is a very um, important institution,
Hmm.
a very important.
Oh yeah.
That's the oil. That's what
Hmm.
that.
That's what gives the people. I don't want to say we give the people are the voices, but at the same time, it's the government that is the one that will listen, right, and be able to put those things into action. And like I said before, if the people are speaking on certain things about what is like the issues that they're dealing with concerning their health, and the government is not taking it seriously, it's very unfortunate, because like I said, health is wealth. Like for example, here in America, I can easily go to, there's so many, apart from even hospitals, there's intermediate clinics. So if I don't even want to go to a hospital, I can go to an intermediate clinic that I can just go and check myself in, like things like that. Finding ways to be able to meet in the middle with the community is so important when it comes to healthcare. And I know even like um a lot of Africans will bring what they know in America, and they will bring it to their countries in Africa, when it comes to like, okay, getting vaccinated or checking your vitals, right? Things like that. That's amazing. I love seeing that. I love seeing our people, right, go back to their homeland and actually want to make a difference, and actually see that there is a need. Sometimes, and that is a thing that I'm like, wow, like if we the people are doing that, and it's like it's great, but if the government is not seeing it, it is a huge issue. Like, I know we're all here to support each other and lift each other up, but the government is an institution where it's supposed to support us and take all of our concerns and our matters seriously. So if they're not doing that, that is a huge problem.
So literally, like the way out is for the government to look into the healthcare and take the healthcare seriously, as you
Right.
said
Take it
earlier.
seriously. That's the first step. Taking it seriously, because we have a very big population in Africa. Africa is a huge continent. We have so much so much technology, so much education. Our people, we are educated, we are smart, we are driven. So it's such a big shame when I see, and I know this is not for every country in Africa, but it is such a shame when I do see every now and then in different aspects of Africa where things are not being taken seriously when it comes to healthcare. I mean, we are the people that's supposed to drive that car of healthcare, because we have so many people that have careers and that are thriving in that field, in this field. So we have medical doctors, we have people that are physical therapists, nurses, nurse practitioners that are Africans. So I feel like if the government takes us seriously and we do, like, speak our voices and make sure it's known and heard, I definitely do think that will make a
That's
difference.
that's very impressive, because like coming from countries of the world, talking about like the third world countries, I know that the government most definitely, as you said, has a very huge role to play.
Yeah.
Because like the policies that are being
The money.
the policies, the finances that goes into the healthcare system is being approved by the government.
Yeah.
And everything is definitely being budgeted for. So
sorry to stop you, but my thing about it is that if an ordinary person that is not a middle class, right, in America comes in, right, with no insurance, nothing like that, they still have to be checked into the hospital.
Really?
They still have to be looked at. Yeah. No insurance, no, like an ordinary poor homeless man. I've taken care.
Is it the law?
And that's one of the things why I love working at a government hospital, is because I'm exposed to different people with people that don't have money, that are homeless, that they don't have anything to give you, but when you give them the care that they need, they're so appreciative of it.
I just show a bit like, is it the law that any patient, regardless of if he's financially stable or not,
they have to be taken, they have to be checked in? It is a law. There is a law. It is a law for you to not turn anybody away at the door when they are in need of help, when it comes to their health.
Oh wow.
That is, and that's the thing. I don't know if that is like that in third world countries, right? You shouldn't have to bribe anybody. You shouldn't have to travel 5 hours away to get care that you need. You shouldn't have to do that. You should have easy access, which should be a birthright, honestly. Easy access to, or not even a birthright, should be a human right to have easy access to healthcare, to be able to be treated, right, to the utmost care. So, I mean, like over here, yes, if you, and this is not for every, this is for government hospital where I am currently working. We can't turn anybody away. Absolutely not. If they're coming in need and they're asking for help, whether they're homeless, whether they're a billionaire, we got to take them in. We got to look at them. Yeah.
Well, that's very interesting. I I really appreciate the fact, and I also like, I feel like countries like I like the fact that you're the medical field, and also I've noticed this, that like when it comes to third world countries, like they they don't really do the diagnosis before. They just like assume, they like
immediately.
They do like assumption medication, like just assume, oh, this is malaria, this is typhoid, and that has definitely caused a lot of issues in
Yeah.
in that. So how important is it
Mhm.
to diagnose a patient before treating them? How important is
Very
it?
important.
Do you think it's I could just like just say okay?
No, so the process that they go through, even here in America, when a patient comes in, doctor, no, it's the nurse that will admit them, right? Will get the patient in. Then it will be the doctor that will come in, evaluate the patient, ask them about their history of health. Do you have hypertension? Do you have hyperlipidemia? Do you have chronic kidney disease? Like what, and then we'll ask them, what brought you in? Signs and symptoms, right? What are the signs and symptoms you're showing right now? So there is a process that
In place.
has in place in America that has to be done before a doctor can diagnose you. The doctor has to even do lab work on you, right? Or they'll order labs. I'll draw the labs. Then we'll look at your levels. We'll look at your electrolytes. We'll look at your CBC, right? We'll look at your basic panel to see what's going on with you, to see what else, apart from the signs and symptoms you're presenting, right? What else is going on with you? So, and also too, there's a lot of education too. There's like these medical doctors in America, they go through so much schooling, they go through everything, they go through residency, to be able to know everything that can come in front of them, basically.
Interesting.
So I would say that experience is very important when it comes to diagnosing anybody. You can't just diagnose somebody and say, "Oh, this is it." No, there's a whole process,
So
right?
it's very vital.
It's very vital. That's why I said that that's why in America, it is, I feel like the healthcare system is a very expensive department because of how important it is. Because it's not just something that is just a piece of paper. There's a whole freaking process that
Goes on.
goes on in the aspect of just diagnosing
Just someone.
someone. Yeah, because when you diagnose someone in this country, it's in their record, right? You can't just say, "Oh, this is what they have. They have malaria." No, you got to go through that whole process. So, yeah.
Well, honestly speaking, I hope you viewers has been able to learn from what Adeshawa has been able to present to us today. As I said, I'm sure that you all heard how she was able to, maneuver so much runarounds from, the start of her career to who she is right now. And I really want to appreciate you, Adeshawa, um, for like I know you have a very tight schedule for being here with me
Thank
today
you.
on Insight with Tayo,
Yeah.
and I'm definitely sure that the viewers also appreciate the fact that you've been here to educate them on your journey and how you've been able to be impactful with people, and also I'm sure they would definitely have they've been able to learn from today's episode. Adishawa, any last word from you?
I would say anybody that wants to become a nurse, give yourself patience, and also give yourself time to understand what you're getting yourself into, and also never lose that drive. Because a lot of stuff is going on, in this career as well. Especially you see it on social media everywhere, but never lose hope. Never let go of what you want or what you want to do. And if it's nursing is an amazing career you should definitely dive into.
Yeah. Thank you,
You're
Adishawa. Thank you.
welcome.
So here is the time where we have to say goodbye. Thank you for listening to this episode of Insight with Tayo. Till I come your way again, have an amazing day and remain blessed. See you soon.